Greetings. I am Dr. LaShonda Wallace, founder and executive director for Seeds of Healing, and it is an honor to spend this time with you. Today, I would like to share with you some COVID-19 and HIV updates. There has been so much speculation about the risks for COVID-19 among people who are living positive. Well, I have some facts I want to share. I have some myths that I definitely want to clear up. And hopefully the information that we share in this space, you will find valuable. And what I desire is that if there's any type of stress and anxiety that this pandemic have caused you, after our discussion, hopefully you will feel a weight lifted. And then you will continue to take care of yourself as usual and practice the recommended COVID-19 precautions. So let's get started. There are some myths. Well, the first myth, that there was a shortage in HIV medication. But what we do know is that that is not true. Persons living with HIV continue to have access to their medication management. And actually, through platforms such as Zoom, clients actually have more access. They're able to reach their providers at times that they had never imagined. Early morning, lunchtime, while they're at work, and even in the evenings. There is not a shortage of antiretroviral therapy for persons living with HIV, and barriers to health care has not changed. Whatever existed still exists, but definitely there's not a greater impact in regards to having no access to care. The myth that antiretroviral therapy will protect persons living with HIV from COVID-19 is exactly what I stated. There's a myth that persons living with HIV and who are taking antiretroviral therapy will be protected from COVID-19. Well, I just want to let you know that although there is therapy for people who are suffering from COVID-19, that treatment is under the strict supervision of physicians in a hospital setting, and likely a setting for someone who is in maybe an ICU. But the regimens that are prescribed for persons living with HIV have not been proven to protect anyone from COVID-19. And I just want to reiterate that, because what we do want to make sure is that you or anyone else that you know who is living with HIV and taking antiretroviral therapy are not sharing medications with the general populations. Because again, antiretroviral therapy for HIV positive persons will not protect you from COVID-19. What we do know are some facts. And the facts are, it is likely that one can have severe health complications related to COVID-19 if they have a low CD4 count. For instance, if your CD4 count is less than 200, and if you do not have HIV viral suppression. So if you are immunocompromised, yes, there is a risk for severe complications. But all persons, regardless of HIV status, should use COVID-19 precautions. And we're going to talk about those in a minute. But people with coexisting conditions, whether they stand alone or concurrently with HIV, those conditions that are high blood pressure, chronic respiratory disease, diabetes, cardiovascular disease, and obesity, these coexisting conditions, yes, they are predictors of poor outcomes from anyone that possibly and potentially contract COVID-19. Just know that there's an increasing occurrence of COVID-19 cases among adults. And it is those young adults that rarely show symptoms, rarely show severe symptoms, that actually put others at risk. And when we talk about others at risk, again, the elderly and those with other coexisting illnesses, high blood pressure, chronic respiratory disease, diabetes, cardiovascular diseases, and obesity. People are being screened for HIV more commonly now because if they show up and they present with a viral syndrome, not only is COVID-19 taken into consideration, influenza is taken into consideration, and HIV may be a part of the screening process. Because of that, more people are actually learning their status. They're learning if they are HIV positive just as well as if they are HIV negative. I do have a great note to mention that because of the risk associated with COVID-19, people are returning to care. So for those people who are living positive and were out of care and maybe had a low perception of health risks, now that COVID-19 is a pandemic, persons are returning to care. And that is good because when people are in care and their virus is suppressed, undetectable means untransmittable. What I do encourage you to do is a daily health assessment. So if you're going to work or if you're going about your daily routine or if you're at home, you can actually conduct a daily health assessment. So you ask yourself, do you have a fever? And if so, is it greater than 100 degrees? Has it been that way for at least one day or longer? Do you have a cough or shortness of breath or difficulty breathing? Do you have chills, fatigue, body aches, a different type of headache, or any headache at all? Do you have a new loss or taste and smell? Do you have a new loss of taste or smell? Do you have a sore throat, congestion and runny nose, nausea or vomiting, diarrhea? If you've experienced any of these symptoms and you feel sick, the first thing you need to do is to self-isolate, especially if you suspect that you have COVID-19 and if you've come in contact with someone else who have COVID-19 until you can get tested for COVID-19. The usual time frame to stay home is 14 days. Again, if you have those symptoms and you suspect COVID-19 and you're not having severe symptoms, just stay home. It is important to highlight that immunocompromised persons may not present with these similar symptoms. If your immune system is weak, you may not even mount a response to such an infection, such as COVID-19. So again, this is the great opportunity to just encourage you. If you've been out of care, if you've been non-adherent, we encourage you to stay adherent and to get in care because we want you to be virally suppressed and hopefully everyone's immune system can be competent to fight off COVID-19 if you are exposed. Emergency warning signs. And these are warning signs that the standard precaution of self-isolation just may not be good enough. And these warning signs will encourage you. Matter of fact, I advise you to seek care. So if you're having trouble breathing, persistent pain or pressure in your chest, confusion, the inability to stay awake, bluish colored lips or face, call 911. You can call ahead to your local emergency facility. If you or the individual you're with are experiencing any of these emergency warning signs, make sure to let the operator know who you are seeking care for and that they may have or you may have COVID-19. Now, the above list of possible symptoms and situations warranting medical attention are not complete. It's important to check for the updated symptoms as the pandemic progresses. They're always adding new things to the list. But that's why you're here also, on the SOTOM platform, because as new information arises, we will make sure that you have that update as well. So we want to encourage you to continue your prevention. Wear your mask. Masks should have 2 layers. You can use washable, breathable fabric. Mask should be completely cover your nose and your mouth. We don't want to see any noses hanging out. Your mask should not be down there. Wear your mask that fits snugly against the sides of your face and do not have gaps. If you wear glasses, you can find a mask that fits closely under your nose, or one that has a nose wire to limit fogging. Do not touch the mask often when you're wearing it. You can remove the mask at the corners by the string. So wear your mask correctly and consistently for the best protection. Make sure to wash your mask regularly in the laundry. So use laundry detergent and the warmest appropriate water setting for the material used to make the mask. Use the lightest heat setting and leave in the dryer until completely dry. If you have multiple masks, you can also allow them to air dry. Now, those things called gaiters, they're like bandanas or tube-like cloths that people use, or face shields that are currently under evaluation. They have not been proven to be effective or just as effective, and there's not enough information at this time for us to encourage you to use that. But when going out in public, keep the following items on hand: your face mask, some tissues, some sanitizing wipes, hand sanitizer that is at least 60% alcohol. And don't forget, stay 6 feet apart. So here are some images that you may find helpful on how to wear your mask. These on this side over here, my left, possibly your right. We want to make sure that you're wearing your mask as recommended. Completely cover your nose and mouth. Have 2 or more layers and fit snugly against the sides of your face. And remember, if you have a child, or if you're viewing this video because your child is affected, but it doesn't matter if they're affected or not by HIV, do not put a mask on children younger than 2 years old. And if you're able, find a mask that is made for children. And if you can't find a mask made for children, check to make sure the mask fits snugly over the nose and mouth and under the chin. So I want to thank you for joining us for this opportunity for the SOTOM virtual platform. We hope that you enjoy all of the resources that we share with you. Again, I am LaShonda Wallace, founder and executive director for Seeds of Healing. Have a great rest of your day.